As oculoplastic surgeons, we see firsthand how the delicate skin and muscles around our eyes slowly change as the years go by. One of the most common signs of facial aging we notice is what happens to our eyelids. Over time, factors like repetitive facial movements, sun exposure, gravity, and loss of fat can all contribute to wrinkling, loose excess skin, and tired-looking eye. The upper eyelids may begin to droop, and the lower eyes often develop bags, hollows, or ridges. As the muscles weaken, the eyelids may also develop problems like ectropion, where they turn outward, or entropion, where they turn inward. While eyelid changes are a natural part of aging, they can significantly impact one's appearance and self-esteem. This is where eyelid rejuvenation procedures come in. When considering eyelid rejuvenation, both surgical and non-surgical options offer pathways to a more youthful appearance, each offering distinct advantages depending on the individual's needs, goals, and condition of the skin and eyelids.